guys, so this will be a tutorial on how to reconstitute your peptides using bacteriostatic water. I have sterile water because we don't have bacteriostatic water here, so we'll just pretend that it is. Obviously it's preferable to use that to inhibit bacterial growth in your peptide. I have an empty vial because I don't have my peptides on me, so let's just pretend that this is a vial of peptides. You're gonna need a syringe to reconstitute your peptide with. I have a 3 ml syringe that comes with a needle already. You're gonna need some alcohol, 70%, as well as an amber zip bag to store your peptides in. You know, you want to protect it from the light. And this is called a steri-temp. This is what you're going to stick on top of your vial just to protect it from further contamination. So you can buy a box of this, and that's about it. So what you want to do first is wash your hands. I already washed mine. And you want to disinfect your surface with some alcohol. So you're just gonna pour some on there, grab paper towels or some gauze, and then just wipe it down. Now I'm going to use gloves just to be safe. You don't have to if you don't want to, or if you don't have some, but obviously if you want to keep it as sterile as possible, use some gloves. I have here polyisoprene gloves, non-latex. And this is how we put them on at the hospital per protocol. So you take your glove, slide it in, take the other, and then you just pull. There you go. Gloves on, and you also want to wipe your hands down with some more alcohol, just to really be safe. So now your surface and your hands are very clean, very sterile. So this is going to really reduce your chances of bacterial growth. Now you're going to take your reconstitution solution and pop the cap off. Oh, and I almost forgot some alcohol, so that was very important. So first, what you're going to want to do is take a swab, put it on your table. Take another swab, and then wipe down the rubber stopper at least 3 times. The reason why I put the swab on the table is so that when you decap your syringe, you're going to place it on the swab to keep it clean and sterile. So you're going to take your syringe that you're going to reconstitute it with. Now, you can use a peptide calculator to calculate how much water you need to use. I'm not going to get into that. You know, you guys can do your own research on that. But this is just to show you how to keep it sterile and as aseptic as possible. So what you're going to want to do in this case, I'm going to want to draw 2 ml of water. So you're going to pull it until the 2 ml mark with air, and you're going to inject the air into the vial to create positive pressure. So you're going to decap, put the cap on the swab, and then now you're going to take your needle, you're going to put it on the rubber stopper at a 45-degree angle, and then 90, and then you push down. And then you can flip it upside down. Be careful not to touch this part, you don't want to contaminate that part. You're going to push the air in. And when you let go, the positive pressure will fill the syringe with the water, as you can see. So you're going to pull. At this point, you're going to have a bit of air bubbles, you're going to want to flip it upside down like this and tap the sides of the syringe to bring the air bubbles to the top. Once it's all at the top, you're going to want to push the air inside the vial, and then you're going to draw until the 2 ml mark. So I'm at 2 ml now. You're going to put your vial down, pull the syringe out, and then you can cap it. Now you can place this down and prep your peptide. So you're going to decap your peptide. Same protocol. You're going to swab the rubber stopper at least 3 times. You're going to want to do this prior to every needle injection. Very important. So now, most of the peptides have a lot of negative pressure, so you don't really need to use a chimney to equalize pressure into the vial, because as soon as you inject your needle in, it just pulls all the water in, so you should be fine. You don't need to use a chimney to equalize the pressure, so we're not going to do that. You're going to decap your water, and then you're going to place the needle at a 45-degree angle like earlier, then 90, then push down. And then you're going to just, as you push the water in, you want to tilt it at an angle so the water trickles down to the sides. You don't want to agitate the peptides too much. So you're just going to push all the water in. Depending on how much pressure there is in the vial, you can see the syringe is filling up with air by itself. So you just want to wait until it stops so the pressure is equalized. There, it's slowing down. You can remove the syringe. And yeah, you see, that's what happens when you don't wait too long, but don't do that. And then as soon as your vial has been reconstituted, you don't want to shake it, you don't want to agitate your peptides, so you're just going to swirl it around. You can kind of like flip it over upside down like that until it's fully reconstituted. So now, once it's reconstituted and you want to store it, what I have here is the Steri-Tamp. You're going to want to disinfect it again before applying the tamper. So you're going to take this and you're just going to seal the top to really protect it from further contamination. So you have that, and you also have your amber bag. You're going to put that in there and make sure you store it in the fridge.